If any problem loading from there, sir, I can.
Journey is coming, not properly coming. So anyway, last time also I spoke about the acute diseases. This time I am going to give a description of chronic diseases. The aphorism 72 is for similar for acute as well as the chronic diseases. Can you read it?
Yes, sir.
Yeah. Please ask them to read. Hello?
Yes, sir.
Everybody please go through this one. So some loading problem is there. I am looking at that one. Anyway, diseases of such a character that which small often in imperceptible beginnings dynamically derange the living organism, each in its own peculiar manner, and cause it go to gradually deviate from the healthy condition in such way that the automatic life energy called vital force, those obvious is to preserve them only opposes to them at the commencement and during their progress imperfect. Suitable, useless, resistance, and but unable to itself to extinguish them, but must helpfully suffer itself to be ever more and more normally deranged. That everybody knows about the vital force, which will control our body in all the ways harmoniously. So suppose anything happens in the vital force derangement, the disease comes. Acute cases as well as chronic cases coming. That was the discussion given. Nowadays, it's fairly common that many male babies are born with the pelvic junction obstruction as well as polycystic kidney disorders. I assure that it is diagnosed early pregnancy, we can treat it with 100% success at the time of the intrauterine life. Using our antenatal series of the medication, and it is diagnosed after birth. It will take 3 to 5 years even. 3 years, minimum 3 years will complete the cure. I have treated a good number of these cases with 100% success, and now also many such cases are continuing the treatment. But nowadays, all the pregnant ladies are go for the ultrasound scan for 3rd month and 4th month. Suppose after the 3rd month, all anomalies we can find out the ultrasound scan. Any anomaly comes. Because nowadays late marriage is coming, some problem are there in the family life, and some tension is there. That's why all the anomaly will come. Some anomaly will come. That we can find out on the 3rd month or 4th month of this ultrasound scan. That you can correct it with homeopathically. That's our homeopathic achievement. Okay? Then, case 1, the polycystic kidney with the PUJ obstruction. A few years back, the 2.5-year-old boy was brought to me. He had a polycystic kidney. The child presented with a reduced urine output and red-colored urine. Bleeding from the urine. He was given medicine to correct the congenital deformity of these kidneys, followed by the most appropriate constitutional remedy. Child was subjected to DTPA. DTPA means the split scan, split ultrasound scan will be taken. DTPA, renogram, scan every year. They are taken every year. DTPA scans. The scan report prior to our treatment shown a large left kidney and a normal size of the right kidney. It's funny one. A large left kidney. A normal one is, right one is very normal. split dysfunction study, DTPA, of the kidney showed reduced the functioning of the right kidney. After 2 years of medication, the kidney size came to the normal and the split function study showed the improvement. Child was continuing the medication and later scan revealed much improvement. This is our motivation. Whenever the complaint comes in the right kidney or left kidney or vice versa, the dysfunction is coming, the small kidney, either left side or right side, and bigger kidney, either left or left side, with a split dysfunction. That we will go to the DTPA scan, we'll then find out. That means 36 and 64, like that it comes. No normality. Normality comes 49, 51, or 50, 50, or 50, 48, 52. It's almost normal. See, here is not like that. That's why I find out there. So they were advised to stop medication and should report after 1 year for a review. For a review study. Recently, they reported with the DTPA renal scan ready with the revealed both kidneys are appearing and normal functioning. The medicines we are given, they say anomaly is coming, no? So correction of the anomaly, the medicine comes to the under Moderator. But similarly, my given the very small one, atrophy one, so that I'll correct the atrophy that size. So I have given the Sibilum 2 doses, followed by second month Medorrhinum 2 doses. Then fifth month, calcarea, the concentration was calcarea. Child looks like a calcarea look, and that's why I gave given the calcarea card. Then tuberculin also given. Tuberculin is the main medicine to protection of the kidneys and brain and all other proteinous organisms. The phosphorus was given because that time the child showed some greedy for the cold water, ice water, very cold water need. So I had given a dose of phosphorus that was corrected automatically. Then again, and fourth to third, 2013, fourth month I given Sibilum 2 doses. The Medorrhinum 10 again I was given. So then again tuberculin 10 1 doses, tuberculin 50 1 dose. See, why I given tuberculin? Tuberculin is a very deep active medicine. So 1 dose is very enough and more. The Sibilum and Medorrhinum we should correct it second year. That's why I given 2 doses always. That's my practice. I'm doing it like that. So tuberculin CM was given 1 dose. Child was given Saclac on the months on between along with the acute medications according to the necessity arranged. So this case I of course I given one day. One time I given the Legobodium 30 potency because that time the child is not showing the proper appetite and some flatulence in the abdomen. So I given the 30 potency of the Legobodium. Legobodium 200 I am giving really for the correction of the appetite. Those who are telling, the mother telling, so my child is not taking any proper food. Always is running and here and there. So suppose I am giving a 1 or 2 doses of Legobodium 200. Child will start the eating without any problem. So this is a before scan report. Can you see it? I told you that just
Yes, sir. Visible, sir.
simple, eh? Yeah.
Visible, visible.
Again, after treatment, that also see the difference. Can you read it?
Yes, sir.
Perfectly. Now the third one. Okay. These are the magic of our homeopathic medicines. Case of 2, huge obstruction. With the left hydronephrosis. Okay, okay. Another child of 54 days was brought to us in 10th December 2016 with a moderate severe hydronephrosis. Child had reduced urine output, and occasionally the child cries before the urination. CTP renal scan shown a moderate to the severe hydronephrosis, the left kidney, along with the reduced dysfunction, reduced function, a function of that kidney, 21%. One kidney is 21%. And with the left PUG obstruction, our medicines were started to reduce the deformities and dysfunctions. DGP renal scan in May 2017 revealed much reduction in the hydronephrosis and the improvement in the functions of the left kidney. Now, also the baby is continuing the treatment because it was connected with the I asked them to take this 3 years treatment. That's why they are continuing the treatment. By the grace of God and with the powerful of our wonderful medicine, the child is now asymptomatic and his kidney functioning are improving. Even then, I'm asking to take the medicines. The medicine was given only Civilinum 1, 2 doses. There is no anomaly there. That's why I given the Civilinum 2, 1. Then Calcarea. Again, the child is Calcarea child consultant. Calcarea was given 1. Again, 10 was given 17th May. Then again, Calcarea 10 was 2 doses were given. Cyclac another month between. See the report. Can you read it perfectly? And after that's before the treatment that one. Then after the treatment, see the report. Can you read it?
Yes, sir. Yes, sir.
Yeah. Normal perfection, renal clearance, and the excretory functions of the good renal clearance and functions of the hydronephrosis the left kidney. That's why everything is written. See, this type of corrections we can do it with the homeopathy medicine. But thing is, we have to go with the mathematic medicine. Then only it happens. Otherwise, it is not possible. Anti-mathematic medicine is only. But meantime, you have to give the correction medicines like beriberi, or some other medicine like even belladonna, I can take, no problem. But here, in this case, I am not given any other medicine. First case, I given the beriberi sometimes some doses. That's for the correction. Yeah. Now we can go for the discussion. See, here I am not included one case, which is intrauterine correction of the kidney trouble. That was actually I made it another slide, but that also not functioning well. It was in the not laptop, other thing. That's why it was such a way this one taken. So next time, inshallah, I will show little more cases with little more discussions, and along with the intrauterine correction of the kidney trouble. That is the best way, as per the homeopathy. It's the best way to treat the patient intrauterine life, so that it will correct it of the delivery. I think one day I found down boy's history. Those were having the anomaly of 18 number. 18 this. Yeah, that means the description is maybe child is born with a monster look. Otherwise, they means the child is born with the death stillbirth like that. That also had taken the given the medicine on 5th month onwards. That was corrected perfectly. She delivered a child under the cesarean. That boy now it is 12 years old boy. I think I had shown some time. Hello?
Yes, sir.
No, I think I am not getting you all. No?
No. You are audible, sir.
Audible, okay. So that case, I think I am somebody which shown that child. I will show it to the boy. Yeah. Then we will go to the discussion.
Yeah.
Okay.
Now the audience can raise your hands and ask questions so that sir will answer your questions.
Next time I will show, make the shortage of my speak. I will correct it next time. No problem. Next time I will assure you 1 hour more. This because I am busy with I'm going to Coimbatore, and because due to this one corona, I should take the report and everything. My driver also coming with me, so I have to little more early. I will start from here. Now we can stay there. Tomorrow morning onwards, 8 o'clock, I may practice and come back. Night. A little bit of what is the restless and what they told.
Hello.
Yeah.
Yes.
Hello. Yes, sir.
Yes.
Sir, we welcome our president, Dr. Ismail Sait, sir. In spite
thank
of
you,
his
sir.
busy schedule, he is
Yeah.
giving you time. Sir, my question regarding PUJ case, you just told that what type of obstruction it was, either a tumor or a calculi.
No, it is stricture obstruction.
Stricture
Or
of
some
the
growth inside the
Yes.
the vessel, the uterine, upper uterine junction.
Yeah, sir.
That's why it happens.
Thank you. Sir.
Sometimes it comes as a stricture of the portion.
Yeah.
Stricture.
Yeah.
Uh,
Thank you. Sir.
Sometimes it's a thickening of the inside the vessel, inside the tube. Both side obstruction will come.
Yes, sir. Sometimes it is bilateral, sometimes it is unilateral.
Bilateral, but bilateral comes in sometimes only. But
Yeah.
usually it comes on the one side only.
Yes.
The hydronephrosis.
Thank you, sir.
Both side will come. Both side is very normal here because all the reports are like that comes. The improvement also coming like that. 42, 50, 60, 56, hour 32, 58, like that. Then after the
Okay, sir.
14 and 51.
Thank you, sir. Thank you.
Sir, had you treated high hemoglobin level? High hemoglobin.
Yeah. That's called, what is that called? Estro?
Erythropoiesis.
That means the main medicine comes in very common medicine. That is Gelsemium.
Sir, which one? Please repeat.
Gelsemium.
Gelsemium.
Oh, yeah.
Thank you,
Gelsemium.
sir. Wonderful, wonderful symptom.
Because symptoms is going like that. Patient always complains of the back of the painful, heaviness of the head and forehead heaviness, and sometimes they got bleeding after 20, 22, 23 hemoglobin level. I have a lot of cases. I have with running, we have some, 2-3 cases after day.
Which
Some cases I've
potency?
treated and cured.
Which potency?
Polycythemia.
Which potency, sir?
One
Which
tenum.
potency?
Tenum I am given that usually. Tenum potency.
How frequency, sir?
Once
Frequency.
in 45 days. Sometimes you have to give the another mathematic medicines by taking the tuberculum or medorrhinum. Sometimes. Otherwise, some of the cases are treated with the Gelsemium only. Correct. Now one
Sir,
lady
no
is there
intercurrent medicine. Sir, no intercurrent medicine during the gap of repetition.
Tuberculum is coming usually. Tuberculum. And sometimes we can give the, I serve some lacquer 200 or something. Some symptoms are coming like that. Lacquer when bellona is coming. in the belladonna, very dangerous one for cythemia. Suppose I am giving it, headache will aggravate and patient will maybe show on hematemesis and severe headache and fainting. I had an experience once. After that one, I am not given the belladonna potency. I am giving some other medicine. With the belladonna injection coming, the indication comes, I am giving with the saturated with the pulsar. Pulsar is the very acute of the chronic, acute of the belladonna. And pulsar is acute of the belladonna as well as the belladonna is acute of the pulsar. So there you can be the pulsar. Sometimes we experience some measles, no? Measles potency is coming again and again. There you have to give potency of belladonna 200 to correct it.
Hariharan sir.
Hello, hello, sir.
Yes.
See, Dr. Sergi, okay, certain fellows are losing weight.
Louder, right?
Certain fellows are losing weight without proportion, and their intaking is more, but losing weight is very, very high. Why it is so? Is
Sound is, I'm not hearing.
hello?
Yeah.
Hello?
And loud me.
Sir, certain fellows are losing weight.
First of all, start. First
Hello,
onwards we start.
Hello, sir. Certain fellows are losing weight without proportion, and they are eating well. And what will be the reason behind it? No pathology.
Yeah, sometimes it comes like that. Eating well, but losing well.
Okay.
He's eating well and using well.
Okay.
That is item.
Sir, item given, sir. No pathology, and item is given, but not improving.
Pathology is not, we should not get any pathology behind it. Sometimes it's only a modification of that one. Constitution.
Sir,
You are given the item.
which potency?
Item
10. Any follow?
Those who are having the marasmus of the emaciation of the buttocks region with eat swell and lose well, that's abrotanum.
Okay, sir.
That's abrotanum.
Item given, but there is no improvement.
Then try abrotanum.
Okay. Okay, sir. So another doubt is that you said, see, anomaly, see, polycystic kidney. See, you have given medorinum, syphilinum, and tuberculum. Both these are all miasmatic remedies. Why you selected the medorinum first, then syphilinum?
Medorinum is a universal correction, anomaly correction. As per Dr. Ismail's view, the medorinum is the universal correction of the anomaly. Syphilis is the universal restriction of the organs. And tuberculum is the functional dysfunctions, universal.
Oh, okay. That is the
that type of this one I am find out.
Okay.
For the practice.
Okay, sir. Sir, another question.
Yeah.
See, one repetizing a case, we will get one remedy, and the patient is, suppose urgent nitric is a hot patient, but we got a remedy that is a chilly patient. Chilly patient is chilly remedy we got, and the patient is hot. Then which medicine we will select?
See, according to that one, we will find out the very red line, very commonly, very remarkable symptoms where it will fall, either chilly or hot. That medicine you can select. So I given the very chilly patient item. Very chilly patient. He always wrapping the body and easily chilled. But he eats well, looks well. That is the main thing. I given the medorinum. This is my item.
Yes, importance should be given to symptomatic repetization. Not importance should be given for the repetized medicine. Okay.
But actually I am telling truth. truth. I'm not depending on, I'm not against with the representation, but I'm not depending on the representation.
Okay.
I have Rado is there and I don't know, Vimya is there. You are losing him. Huh? No. The radar on there. We have in the hospital radar is there, and the Java charts minimum is there, but I am not depending on that. Sometimes I ask my assistant to go through the reportation and get the medicine. Suppose there I get any rare medicine, even a single symptom, I will try that one. I will success.
Okay.
Only that purpose I am using the reportation. But I am not against. I tell you very frankly, I'm not against. My boy, my son also prepared a card repertory of something 2000 something cards, no. So I am not against the repertory, but I am not using the repertory very beginning. But I am using the repertory only for the suppose after the repetition. Suppose we will get any rare medicine. There is no thinking of the relative which is the symptomatology. That medicine I can select, I can give, I will go to success.
Sir, next question. See, can you say the approach to an asthma patient? The protocol of the how is your approach? Is it constitutional or symptomatic?
Constitutional, no. Oh, there I am finding out the symptomatological. Because suppose I ask my patient, starting with the sneezing, coryza, and the cough, I will try the naja. Suppose a boy starting with the cough, with a severe pain in the chest and back, and followed by asthma, I will try their Kalikarmonicum. Suppose they are getting the asthma on the midnight, waking from this coughing and staying up, there I am trying the lacasis. This is my peculiar type of practice I am doing. In my practice, I got 100% success.
So, okay, there is no other finishing medicines. Is it
sometimes no need of any medicine. If suppose I am giving the lacasis, you give the lacasis 200 throughout the month of the throughout the course. No need of making a higher potency of lacasis. Suppose I am giving the lacasis a high potency, asthma will come again.
Okay.
But Kalikar not like that. Kalikar we can go with the low potency to high potency. We'll get success. And in Naja also like that. We will get you. But lacus is not like that. Lacus suppose using the net potency, asthma will come back.
No need of any constitutional medicine.
No need of any constitutional medicine.
Okay. See, any intercurrent remedy during the course of treatment? I mean, tuberculum or
because again, any intercurrent medicine comes only of the deranging of the symptoms only. Suppose the symptoms are deranging, there you can give the intercurrent medicine.
Okay.
Otherwise, no need of.
Okay. In allergy cases also, your treatment is like that. In a simple
allergy, only allergy means sneezing in the morning, early morning. By waking up, that is natural sulfuricum. There from the bed onwards, the lacasis. And from the evening, they are getting the sneezing, and again it will come from the morning, arsenic album. But arsenic album, suppose it is not cure the asthma in all the sense, but it can cure the asthma patient. It can cure the asthma patient with arsenic album. But there you have to find out the length signs and start with the low potencies. Arsenic album 3x, 6, 12, then 30, 200 like that. Then we will get a cure. It's also very rare one. But when the length is very wrong and restless, you can start with the arsenic additive.
Okay.
Then also you give the additive very long period until the length signs are disappear. Then you can switch on to hypotension. 30, 200, 1000. You can switch on that.
Sir, if you are-
Otherwise, you should not go for hypotension. Give the 4x. I'm using 4x, but everybody giving the 3x because I find some anomaly. Suppose a long use of arsenic adatum 3x, the skin combination comes. After starting the 4x, for I made myself, then I given it. After that, I got the experience. My factory also producing the 4x potency. And other companies are not producing the 4. They are giving the 3x. Just 30 to 100 again.
Natural self, which potency you are preferring, sir?
Natural salt, high potency.
High
Suppose very
potency.
acute thing is there, start with 30, then go to the give a intracurrent or tuberculum. There we can give the intracurrent. Tuberculum.
Okay.
Okay, Dr. Reshma.
Good evening, sir.
Good
Can you explain in brief about the epilepsy management?
Epilepsy management. We
Yeah.
will start another chapter. No? Anyway, suppose a epilepsy patient comes in with headache.
Okay.
What do you think? They're telling, so suppose I'm having a severe headache after my epilepsy. And after getting sleep, good sleep, I will get better. What the medicine come under your experience? Nothing but before Rana. Before Rana.
Okay.
Okay?
Okay. Potency, sir? Potency?
200, then again, high potency.
Okay.
Start with 200.
Okay.
Suppose any anomalies comes in the brain. Suppose, my fashions, I'm giving the fibrillary conversions medicine. Once I told you, once I given the description. Tuberculum, Panam, Tenum, 50 mcm. Suppose the child is having the concentration of the calcarea, first calcarea, then tuberculum, Panam, then Tenum, 50 mcm. In 7 months' time, we can finish the treatment pattern. But in allopathy, they are giving the medicine up to 5 years or 6 years until our thermostat start.
Yes, sir.
Nowadays, thermostat is starting on 7th year, after 6th year. So
Okay.
they are suggesting the medicine, the
Okay.
anti-epileptic medicine up to that time.
Okay.
But we are not giving it such a prescription, only giving the 6 months or 7 months treatment. Pakka, it will cure.
Okay.
But sometimes it will recur. After 3rd month or 4th month, I send the patient to the EEG report, then we find out it's epilepsy. Epilepsy, you have to give 2 years treatment according to the symptomatology. Then also we got very success, not only for allopathy, here also. Suppose they are coming with allopathy medicine, but they don't withdraw the medicine suddenly, gradually tapering, then give our indicated medicine.
Okay.
Suppose any lesion in the brain, think about the Silesia and tuberculum.
Okay, sir. High potency. Okay, sir. Okay, thank you, sir.
Hello.
Dr.
Yeah.
Sufanjis, yes.
Hello, sir. Please repeat asthma medicines.
Asthma medicine.
Yes.
Asthma medicine means, suppose we are starting the asthma patient starting with the sneezing, coryza, cough, then asthma. That is nausea. Okay? And suppose he is starting with the midnight, there is no, up to that time, there is no complaint, he sleeps well, and 10 o'clock or 1 o'clock, jumps out from the sleep with the cough and the dyspnea, that's lachesis. Right? And any complaint, any patient is starting the asthma with the cough and pain, chest and back. There you can think about the cardicarbonicum. These cardicarbonicum start away 30, 400,000 that they can go. Lachesis start with only 200. Nausea also 200, start with 200. But you go up. Lachesis don't give any other high potencies, it will come again. Okay?
Sufanjis, you can, any other questions?
No, sir. That's it. Thank Thank you.
Okay. Okay. Dr. Lokmani Gupta again.
Yes, sir. Sir, one question, sir.
Yeah.
Schizophrenia trouble is increasing day by day. Schizophrenia. Sir, if it is curable or treatable,
Yeah.
please
I
explain.
cured many cases. I cured, no, not many. There's only few cases I'm cured with the platinum and this platinum will come very nice medicine. Then onosmodium, both sides cover. Hyper and hypo. Onosmodium. Then hypo with the hypo action comes with the schizophrenic. There we can think about the lycopodium. Suppose you want to raise the power of the male capacity, you think about the Nuforlutium, Damiana, then Prostitute. That you will not get from the market. I have developed one medicine, CAQ, that is in cancer conditions. Suppose they are having the spreading character, secondary is mutiny secondary. There we can give this CAQ, we can control it. Very, very strongly we can control after the spreading of the or after the new secondaries. That medicine also private medicine, single medicine. Plus two also single medicine. Suppose anybody need it, I'll send you. Free of cost or cost.
Lokmani Gupta, sir, any other question?
No, sir. Thank you, sir. Thank you, sir.
Okay.
Thank you.
Yeah, Hariharan, sir. Hariharan, sir.
No, sir. Sir, for hyperactive child, what is the protocol of treatment, sir?
Hyperactive, which is sucking and the injuries of it, exomic hypotension.
Okay.
A dose of 50 mg you give late and morning, and then within a 1 month time, the child will control.
Okay.
I'm giving these medicines, and the first month, second month, the child become normal and very pacific. Now very gentle. Today also I got one case. Today also I got one said, the mother telling, now is very perfect gentleman.
Okay.
Exomic
Sir,
50
this 5-year-old child without any head injury. History of a 5-year-old boy, no history of head injury or nothing else. But the child is very hyperactive. They can't control the child.
You exomic. You exomic 10 potency but
Okay.
yeah. Within 2-3 months he will come under control.
Okay.
Suppose that become child is become idiot. After exomic you start with the brain attack.
Okay. Correct. Serious. Correct. Okay, sir. Thank you, sir.
Dr. Nimisha.
Sir,
Yeah.
L4, L5 disc prolapse medicine. L4, L5 disc prolapse. Disc prolapse L4, L5.
Only perhaps,
With yes, disc prolapse and pain radiating both legs. Weakness, especially below
did
the
the patient
knees,
having the
underneath.
severe pain on lumbosacral region?
Yes, and it is also radiating downwards, especially below the knees. They are having weakness and pain.
Then if it goes to the left side, right side, which side is that?
Both sides.
Both
Yes.
side, okay. Both side also
Both sides.
the gonosin is coming. Gonosin. Suppose it goes to the right side, nacus is coming. And only the fake pain, lumbosacral severe pain, we can't move here and there. Stuck. As a Robert standing, there you think about the anti-monotartical tendon. Antimony datarika, tendon
Okay.
potency. Suppose any no congestion is
Colos in the
there.
potency.
Eh?
Yes.
If
Potency
any
of colos
congestion,
in the
കൊടുത്തില്ലേ?
potency.
1 10.
Potency, sir. Okay,
Yeah.
sir.
Suppose any nerve compression is there, you start with a low potency of ginseng. Ginseng, messenger.
Okay.
Suppose
Okay.
you are given 8 drops every 4th hour, within a day time it will control. Suppose the prolapse
Okay,
is one
sir.
sided, we give the even this IVDP traction. Number traction also given. For hospital, we are used to give the number traction.
Thank you, sir. Thank you very much.
Dr. Sophanjis?
Hello.
Yes.
Sir, what is the treatment for high astigmatism with squint?
Then louder, please.
What is the treatment for high astigmatism along with squint?
Hyper.
Astigmatism with the squint.
Huh.
Astigmatism, sir.
With
With the squint.
Yes, sir.
Squint.
With the squint.
Yeah. Turning to one side.
Yeah.
Yes.
There you can think about the causticum. Either left or
What's that?
causticum comes either the medial or lateral. Both sides come.
Yes, sir.
Causticum.
Causticum. And what is the potency, sir?
One arm. Start with one arm. Within one or two,
So we have
2
to
months, maximum 3 months, it will correct it.
Okay. So each dose in
But
for 1 month.
the exhibition with the wide people, here you can think about the opium. Wide people. The reaction
Sorry,
also,
sir, please
light
repeat.
reaction also very low. Here you can think about the opium.
Opium when?
Opium potency 10 m. That's 10 m potency.
Okay, sir. So when we would consider opium 10 m, sir, please repeat. Opium 10 m, when we would we consider?
Yeah, we will consider. But only the where to consider. Eh? The papers are very dilated. Very impaired to reflection of the light.
Okay, sir.
Sanjay Shakya.
Thank you, sir.
Sanjay Shakya. Dr. Sanjay? Yeah. Please unmute you from your side and ask.
Good afternoon, sir. Actually, sir, I wanted to know something about this treatment of the fibrocystic disease of the breast.
Fibrosis of the breast.
Yes, sir. Fibrocystic disease of the breast.
Yeah. But suppose the growth is very high, give a dose of melandrinum, then ask the one to remove that growth. After giving a melandrin to 1000 potency or 10 potency, 1 or 2 doses, then I ask the patient to remove the lump. Nothing will happen. But it will after the melandrinum. Then you can give the constitutional medicines.
Okay, sir.
Small fibrotic conditions, or you can treat with the Sarisha 0/3, Sarisha 30, Sarisha 200, Conium. Suppose any tumor comes with the vertigo, turning the head vertigo, they are thinking about the conium.
Okay. Okay, thank you, sir.
Dr. Geeta, MT.
Sir, good evening, sir. Good evening.
Good evening.
Sir, I am Dr. Geeta, Department of Pathology. Remembering me, sir?
Yeah.
Geeta,
Gita means?
in a Department of Pathology, Government.
Yeah.
Good evening.
Tell me.
So what about the treatment of narcolepsy, sir? Narcolepsy.
Narcolepsy.
Um,
I don't have much experience that one. Experience that one. Yeah.
patient, he is 32 years old and sleeps always. Like sitting for 5 minutes or 10 minutes, he sleep for 5 minutes. Always sitting and sleeping. He is suffering from gallbladder stones also. After sitting for half an hour,
Yeah.
if he is alone, means he will sleep.
Please unmute, sir. Please unmute. You are muted. Yes.
Yeah.
Dr. Shadi, I am not audible.
You are
Audible.
you are audible.
Audible. Tell me. Hello.
Geeta madam is asking, the patient sleeps when alone.
When alone. By
Attending?
sitting.
Maybe some
Patient,
causes, one reasons are there. Maybe due to fear or something like that. But this type of people, I'm not using much medicine, but I'm giving the opium caliphos hypotensive.
Okay, sir.
Caliphos hypotensive.
10 m or 50 m we can use.
Yeah. Caliphos 6 is not useless medicine. But even the placebo will get, suppose some patients get it, I am not living well. I'm giving the tablet of 5 grain, and then naturally they are asking the social, no, that not that much of medicine given to me, half. So, psychologically.
Otherwise, that
IP, we will spend that type of funny things. But usually, due to this one, due to something reason was there. The reason he find out, give the medicine for the reason, either natriumur, ignitia, and caliphos hypotensive, or some other thing, sapsagria will come, sapsagria. Because always the one man is harassing with the superior officer, harassing. Anything you write thing, they will find out the wrong things. Harassing and shouting every day. Every day shouting. So gradually he depressed, become depressed. He's not going to the ignitia and natriumur. He goes to sapsagria.
Okay, sir. Sir, what about next mashata? Next mos?
Next mosquito, not well medicine, but we can give psychologically, we can give. Next mosquito 200.
Okay.
We are also giving our OP, mosquito. When the very, very worrying mind, always puzzled and worrying mind is there, they can give the next mosquito.
Hariharan, sir.
Thank you very much, sir.
Sir, one more question.
Yeah.
See, carpal tunnel syndrome.
Yeah.
Any medicine? It is any curable medicine? Carpal tunnel.
Any
syndrome.
curable. We have curable medicines. Then any one medicine I'm giving you. Okay. Give that medicine and get the reaction. Then again, you call me again. Silicea tenuum.
Okay, Silicea tenuum. Okay.
Even the post-operative carpal tunnel syndrome also correct.
Okay. Thank you, sir. Thank you, sir.
There are few questions in the chat box, sir. That is fibroid medicine. I think that is already answered. Cerebrovascular accident medicine.
Arnica is the main medicine. 30 potency. 30 not high potency, 30 potency. Start with 30 potency and make sure the 1 or 2 drops of arnica 30 in the 25 ml of aqua. Give 3 drops every 5 minutes and 10 minutes. The patient will recover and open the eye and recover within 2-3 hours. And after getting the conscious, you can start the high potency. Otherwise, you will start only the 30 potency. You can manage severe cases in the medical colleges and other private hospital patients. They are telling that we will say after 24 hours. They are telling that within 24 hours they will survive with our medicines.
Myopia medicine, sir. Myopia.
Myopia is a natriuretic. Natriuretic hypertension. Venom.
Keratoconus after vaccination.
Keratoconus after vaccination, Puja comes. The respiratory complaints comes after vaccination. Natrium antibody will come. Any ulceration comes or any abrasion comes, that's an issue. Only 3 medicines was given by Kent. And that's the principal medicine is Tuja. Here also vaccination going on. Suppose they are getting to us, we can correct it within our medicines.
What is the second medicine you said, sir?
Go
What
for
is the
that.
What is the second medicine, sir?
Eh?
Puja, Silesia, and one more medicine you mentioned?
Antimonium tartargium. Antimonium tartargium. Wonderful medicine. Antimonium was the, suppose I saved 2-3 dead persons, no? They are going to die within minutes and hours. They survive with the antimonium tartargium. Only because the mental symptom. But the mental symptom I told you that time. Suppose we are going to examine the child or feel the pulse, they will stare at. They will stare at and they scold. They are not scolding, they stare at and they will deny our pulse. And don't think anything, use the antimonium tartargium, definitely the child will survive.
Trigger finger medicine. Trigger finger. Trigger finger.
Trigger finger, that means that will like this, no? Cupramatricium. Triggering of the fingers. Cupramatricium 10 no other potential will work. Suppose we are starting with 200, the 10 also we feel useless. Straight away give 10 that's it.
Then tennis elbow, sir. So tennis elbow.
Kali bichromicum. Silesia. Silesia is pain comes in the tennis elbow with a soreness of the surrounded area. That is silesia. Suppose the pain only on the tendon that the spot, that is Kali bichromicum.
Calcareous
We just pursue with the finger, they feel pain. That's Kali bichromicum.
Calcareous spur.
Calcareous spur on Metallicum 30.
Spur formation.
Yeah. Calcareous spur on Metallicum 30 potency. And calcareous flow 30 potency. These two medicines and most effective is on Metallicum. The pain will be pain relief within second day onwards.
Hariharan, sir.
Hello, sir.
Yes.
Any medicine for ingrowing toenail?
Ingrowing?
Ingrowing toenail, nail. N-A-I-L, nail.
Ingrowing and this one, finger.
Toe, great toe.
Toe. Oh, yeah.
Great toe of the feet.
There you do one thing. Either you start a high silesia, high potency, or give a solution of the calendula every day, morning and night, and get some relief, then go with the silesia.
Okay, I can try my best, sir.
Okay, then temporomandibular arthritis.
Temporomandibular
arthritis.
Which side?
I don't know. It is a question in the chat box.
Yeah. Then we can
If Dr.
take the-
Nimisha, you can raise your hand and ask the question directly.
Yeah,
So that
Sainisha is coming. Sainisha is coming. Suppose in the left side you go through lacuses. Mainly. Sainisha, both sides will cover.
okay, sir. Then diabetes mellitus.
Diabetes means lycopodium tendon. Give once in 2 months with your drainage medicine with natron sulfuricum 12x. Suppose any medicine they are taking allopathically, don't withdraw it immediately, gradually withdraw it. But treatment, those who are taking the insulin, don't withdraw the insulin immediately, but change the pattern. Now, all allopathic medicines, allopathic doctors are advising to give them insulin morning hours and night hours. That is more dangerous. Night only. Suppose they are having the FBS more, they are giving the insulin night only. Today also I got this. Today also I got one case. I advise them. Can you go to dive in the sleep? Ask the child, man. Your wife is sleeping with you, but she cannot help you because you have become hypoglycemic. Suppose you are not responding well, will die in the sleep. So do one thing, don't go for a night insulin. Go with noon actually, noon time. I am advising the patient to the insulin patients use the noon dose, then night dose, or noon only. Along with our medicine, that means along with the concentration, our medicine is lycopodium tendon. The natrum sulfuricum 12x, suppose we are giving thrice daily, it will control the some extent.
Okay, sir. Then lipoma protocol. Somebody is asking. Sanjay Sakya.
Lipoma.
Lipoma.
Yeah. But very dangerous to cure the lipoma cases. But oftenly we can give Puja 30 potency, Calcarea carb 30 potency, Calcarea floor 30 potency. That will give us good.
Then alopecia.
Alopecia areatica or alopecia totalis?
Aerata.
Totalis.
Aerata, sir.
Aeratus. Phosphorus main. Phosphorus. Then syphilinum. Suppose a patient having a syphilitic constitution, it will correct it within no time. Phosphorus high potency, 10 potency, give twice in month, 15 days interval. Within 3-4 months, it will correct it.
Heel pain, sir. Heel pain.
Heel pain. Medorrhinum and Tuja. Both psychotic. One planned is psychotic, one knows what psychotic.
Then
Chat box are empty.
Then due to online studies, children getting more eye complaints.
Yeah, I come on because they are giving the time the very night and suppose they are relaxing time they are asking for attending classes. That's why it gets. That is the ego. The mental agony is coming. Mental incompetency is coming. That's why it happens. That is there. Actually, they have to obey. They have to obey the things without any their consent or their appeal. There we will go to apsacria.
Then glaucoma.
Glaucoma lacusis, gonoid, deltemium. Lacusis is the wonderful. Most of the cases we can control the glaucoma. And Bothrops also. Bothrops.
Lachesis, glanoin, and
Lachesis and both very efficient medicine. But the Gelsimia and the gonoin also comes for acute form.
okay. Then they are asking the heel pain medicine potency. Heel pain medicine
30. Aromaticum 30 potency.
Okay.
No other potency will work.
Now, heel pains are, you said medorinum, 10M. And
That also, that is 10M potency.
Yeah.
10M potency, medorinum 10M or Tuja 10M. Variations there. I think the calculus is per, no?
Yeah. Orum.
Tendoacrylis and heel pain, medorinum. Tendoacrylitis.
Okay. Then Dr. Sujeda is asking where to get CoQ10. Where to get CoQ10? Your special medicine. You mentioned something medicine, CoQ10.
My medicine.
Yes.
That is a CAQ and plus 2Q, not plus 2Q. That medicine will get it in all homeopathy outlets. Not all, very costly. The main shops they are getting stock.
Okay. Now, filarial swelling.
Calcarea floor 32 high potency with the mercurial sulfate. Mercurial sulfate. And any pain, fever also coming every month or like that. Give the dose of arsenic album 1 potency 3-4 months with the calcarea flow. So the swelling also reduced, the pain will control, the fever also controlled, it will go like
that. Aphasia after cerebrovascular accident.
Aphasia.
Yeah.
There is only one medicine I got it. No, only one instance I got it. That I corrected with this ornic hypotension. Ornic hypotension. I given that time 50 potency was given. After 5 or 6 I got the return there. Only one case I treated. Only one case.
Okay.
That also some 3-4 years back.
Tinea cruris.
Tinea cruris with the discoloration of the groins, arsenicum album. 1 potency, or 10 potency. Then bacillum, 10 potency. But always you ask the patient to clean the area with soap and water, then use the coconut oil. Then Indian medicine. Indian medicine, you have to give at least for 6 months. This cleaning purpose also do the 6 months thing.
Varicose ulcers.
Varicose and synesthesia. Acid floricum. Acid floricum hypotency, synesthesia also hypotency. About 10M. 10M. Beginning was the 10M.
Any other questions? Please raise your hand and ask your questions. Schizophrenia recurrence in old age. Violence.
Old age, no, get that. Old age, experience with the old age schizophrenia. One college lady, girl, came to me at when I when I joined the Toronto College. No, one girl is coming to me my home. They're asking the very frankly, and they're having the very deep sexual affiliation with the same sex. What is that? I given them this one platinum, the lady, she corrected.
Constipation children.
Lycopodium 200, opium 200, syphilium 10. Syphilium habitual constipation is there birth onwards. Syphilium. Rhumba metallicum, suppose we are giving very constipation which for 5 or 6 months days, given 200 potency, 3 doses, 1 hourly, and 4th hour he will pass you through. That's our experience. Suppose I am giving that 1 potency, 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock, definitely he will pass it through.
Hariharan sir.
Hello, sir. Any prompt medicine for positional vertigo, sir?
I not attended them.
Positional vertigo.
Positional vertigo.
Vertigo.
Conium.
Vertigo.
Conium. Nothing but.
Conium, which potency, sir?
200. No other potency will work.
200.
Yeah.
How is cocculus, sir?
Cocculus will be temporary medicine. You will repeat again. Maybe we will control. Maybe.
Okay.
Tobacco also there is medicine. What I am giving the medicine, sir, which one I experienced in my practice, and I clear the all anomalies. Then I am giving the medicines. Tobacco is there. Cocculus is there. Of course, but wonderful medicines are conium.
Okay, sir. Thank you.
Dr. Lokmani Gupta.
Sir, it is by mistake. Everything is okay. I'm getting the points.
Okay. Thank you. Now, varicose vein severe on legs.
Yeah. If it comes only on the right side, if it comes on the left side, if the both side is there, or specifically we can give like a calculate plot 200 or 1 minute, 200. And Hotonia mother teacher, very rare medicine, but Hotonia will relieve the pain immediately. And Pulsar also will relieve the pain and this one. But very common it becomes Calcarea floricum. And
Right
Lacus
side.
is on the left side and Lycopodium on the right side. And both side is Silisha. Sorry, Calcarea floor. Even one side also they will work.
Left side, which one, sir?
Left side Lacus.
Okay. Now, headache with the choroidal fissure cyst in brain.
Headache with the
Choroidal fissure cyst in brain.
I have not experienced so far, but medically we can advise Silisha. I have not given any patients like that, but clinically the symptoms is agreeing with the Silisha. Suppose any patient comes to me, I will try it like Silisha.
Vertigo due to ear problem. Vertigo due to ear problem.
Ear problem, conium.
Now, prostate enlargement. Prostate enlargement.
Prostate enlargement, Tuja, conium maculatum.
Potencies are.
Conium maculatum 200. Gradually raise the potency. Tuja, gradually potency, 30 potency onwards. Then of course we have wonderful tincture medicine here. Sabal Tharleta, Timophila umbrellata, Ua Versae. You see you know the differences between that one? Timophila umbrellata, they will stand up in the close up. Sait, and press your both hands in this wall. Then only urine passes. That's Haemophila amberlata. Then apart this, widely apart these fingers and just chopping on the closet, that who would say. No, umbrella was umbrella. Who was the way lie down on the floor, then lifting the buttocks to pass the urine.
Dr.
Who would say?
Dr. Srilashmi Shankar.
The sudden onset of sneezing followed by coryza, sir.
One.
The sudden onset of coryza and sneezing almost every day the patient is having.
Naja.
What medicine?
Naja.
Naja. Which potency, sir?
200 potency. Do 200 potency once in 5 days, once in 3 days, or once in a week. Don't give frequently.
Okay, sir.
My pattern is divided into 10 doses to one drop of nature.
Geeta madam.
Sir, what about Parkinsonism, sir? Parkinsonism.
Parkinsonism is very difficult to cure, but we can manage it with gelsemia and agaricus. Agaricus, you don't expect any positive sign within 2-3 months. Give it, forgetting it to them, giving the medicines, one potency for several months. After 6 months to 7 days, gradually it will get some improvement. Suppose if you are getting improvement, some 25%, give a dose of Ifph, then again give to this one.
Thank you, sir. Sir, Alzheimer's disease, Alzheimer's.
Alzheimer's is Syphilinum.
Syphilinol.
Syphilinum and anacardium. Anacardium is wonderful medicine. For a time being, suppose they are giving anacardium, you will get cured. Then Brahmi also, Brahmi, suppose you are giving 200 potency, you are getting it very, very difficult. You make it yourself. So it's a very good medicine for the this one. Yeah.
Thank you, sir.
Hariharan sir.
Hello.
Yes.
Sir, I am asking a simple question. Simple question. നമ്മുടെ നാട്ടുമ്പുറത്തൊക്കെ സ്ത്രീകൾ എന്ന് പറയുന്ന ഒരു കാര്യമുണ്ട്. എന്താ അറിയാമോ? നീരിളക്കമാണ്. എനിക്ക് നീരിളക്കമാണ് എന്ന് പറയുന്നുണ്ട്. അതാണ് ഞാൻ
മയോസൈറ്റിസ് ആണ് നീരിളക്കം. ഏറ്റവും നല്ല മരുന്നാണ് റെസ്ട്രോക്സ്. ഒരു 1/10 പൊട്ടൻസി കൊടുത്താൽ മതി. ഒരു ഡ്രോപ്പിന് 10-15 ഡോസ് ആക്കുക. അതിൻ്റെ അകത്ത് മിനിറ്റേക്ക് പോത്താ പറഞ്ഞ് നീരിളക്കം വിൽക്കും.
സാധാരണ പറയുന്നത് സാർ, അല്ല സാധാരണ നമ്മുടെ നാട്ടിൻപുറത്ത് പറയുന്നത്.
പണ്ട് അലോപ്പതി ഡോക്ടർ പറയുമായിരുന്നു നീരിളക്കും. അത് എവിടെ നിന്ന് വരുന്നത്? ഇറങ്ങി വരുന്നത് തലേന്ന് ഇറങ്ങി വരുന്നു പറയും. തലേന്ന് ഇറങ്ങി വരുന്നു, പിടലേന്ന് ഇറങ്ങി വരുന്നൊക്കെ പറയും. Running from the head, running from the transverse from the hip joint. They're acting and telling you. They're acting it.
Correct, sir.
Stroke is the medicine.
Okay. Minimum potency, divided potency we can try later.
അതുവരുമായി ഒരു ഡ്രോപ്പ് ഇട്ട് 10-15 ഡോസ് ആക്കുക. എന്നിട്ട് പുറത്ത് വന്ന് കഴിക്കാൻ പറയുക. ഫിനിഷ്.
Try later, sir. Okay. Thank you.
പിന്നെ വേണമെങ്കിൽ ഹൈപ്പർടെൻസി കൊടുത്താൽ പിന്നെ റിപ്പീറ്റേഷൻ ഉണ്ടാവില്ല. കൊടുക്കാതിരിക്കാൻ നല്ല കൂടെ വരാമല്ലോ. ഒരു ഡോക്ടറെ മകനെ പറഞ്ഞ് MRCPക്ക് വിട്ടു. ലണ്ടനിൽ പഠിച്ച് പാസ്സായി വന്ന് പക്ഷെ ഡോക്ടർക്ക് മസൂരി പിടിച്ചു. 10 വർഷം മുകളിൽ വന്നില്ല ഹോസ്പിറ്റലിൽ. മകനെ കയറ്റിയിരുത്തി. അവൻ വന്നപ്പോഴത്തേക്ക് പേഷ്യൻ്റൊക്കെ നല്ല സാറ്റിസ്ഫൈഡ് ആണ്, കുഴപ്പമൊന്നുമില്ല. അപ്പം മകൻ പറഞ്ഞ അച്ഛനോട് പറഞ്ഞു, അച്ഛൻ എന്തായി കണിയോ അച്ഛൻ, അയാൾക്ക് ഇന്ന മരുന്ന് കൊടുത്താൽ മതിയായിരുന്നല്ലോ അമ്മ പോരാണ്. അല്ല മോനെ നിന്നെ പഠിപ്പിച്ച ആ പൈസ കൊണ്ടല്ലേ ഇങ്ങനെ വലിപ്പിച്ചിട്ടാണ് പഠിപ്പിച്ചത്. അയാൾ നിന്നെ കൊണ്ട് MRTP ആക്കിയത്. നീ വന്നിട്ട് തുലച്ചു എന്ന് പറഞ്ഞു.
Okay, thank you, sir. Thank you.
Psoriasis, sir. Psoriasis.
Wonderful question. Wonderful question. My favorite question. Arsenic adatum 3x, 4x, and thyroidinum 4x with syphilinum and thyroidinum hypotension. These 4 medicines enough. Syphilinum 10, thyroidinum 10, thyroidinum 3x, and arsenic adatum 4x. These 4 medicines enough to cure the psoriasis. Plus, suppose it is locating on the head only, head and the vertex only, think about the soreness. All head also soreness. Suppose it is locating on the back of head, occipital, think about the petroleum. With the arsenic adatum 4x or thyroidinum 3x. So immediately will get it.
Okay. Then gum bleeding. Gum bleeding, sir. Gum bleeding. Gum bleeding. Bleeding from the gums.
Gum bleeding. ഞാൻ ആ ഡോക്ടറെ വിളിക്കാൻ നേരിട്ട്. Acid nitricum, creosotum, offensive gum bleeding, creosotum 10, and severe gum bleeding on touch, acid nitricum 10 important. Okay, immediate action at all.
Okay.
And 2 ദിവസം കൊടുത്താൽ വീട്ടിൽ അതിന്റെ വില അറിയാം.
Okay.
കൊടുത്തോണ്ടിരിക്കണമെങ്കിൽ തേച്ച് കൊടുത്തോണ്ടിരുന്നാൽ മതി. അവിടെ വന്നുകൊണ്ടേയിരിക്കും. ഒരാഴ്ച കുറേ ഒരാഴ്ച വരും.
Anybody else wish to ask question? Please raise your hand and ask to sir directly. Hariharan sir.
Participants are also getting down. 54 now. 57, 54.
Hello,
so
sir.
there are also no capacity of asking further questions. If there is nobody there, we will wait up so that I can start from here by 6:30.
Hello, sir.
Hariharan sir.
Sir, any medicine, prompt medicine for dandruff?
Dandruff. My God. Soreness is a medicine.
Okay, which one?
Soreness, hypotension is a medicine. 10 number 15 will give.
Okay. Thank you.
You can control it, no problem.
Yes. Any external
Saju
application?
Joseph.
Any external application?
What?
Any external application we must do?
Arnica medicated oil.
Hair oil. Okay.
Arnica medicated oil or this extra lava medicated oil.
Okay.
Extra lava.
Okay.
Like your 3x act with the coconut oil, then we will
Okay.
Arnica.
Thank you, sir.
Hello, sir. Namaskaram.
Namaskaram. Well, I join you. Dr.Ismail.
Hello.
Hello. After ulcer with blackish discoloration of lips.
Lips only.
Lips only.
If it is happens on the after 50s, think about the carcinosin. It is happened on the before 50. Puja.
Carcinosin which potency? Carcinosin which potency?
10. Puja also 10.
Oh.
അപ്പോൾ ഇനി അടുത്ത മീറ്റിംഗ് ഇല്ലേ സജി വർഗീസ്? Saji? Some meeting also there?
Yeah.
It's better to wind up.
Yeah. We'll wind up now.
By 5:30.
Yeah. We'll wind up today. So all of you get ready for our next session on coming Saturday, 15th of September, August.
Coming Sunday.
Coming Sunday.
And actually,
not tomorrow.
Talk itself about 1.5 hours, 2 hours.
Okay.
Not tomorrow. Coming Sunday. At 3 p.m.
Yeah. Not tomorrow, next Sunday. Yeah. Okay.
Okay.
Hariharan
Okay.
sir, you can ask the last question, sir. Hariharan sir, last question.
Okay, sir.
Okay, okay.
It is a last question. Sir,
Yeah.
one of my gallbladder stone case. Can you hear, sir?
Yes,
Yeah.
yes.
Yes, yes.
One of my cholelithiasis, all the symptoms are relieved. And on examination, US can find out that the stone is there, but all the symptoms are relieved. Then why
Okay,
the stone
fine,
is
fine. I will suggest one non-homeopathic treatment.
what is that?
That means green apple, green apple,
Green apple.
small green apple, 3 or 4 number, collect it.
Okay.
And
Okay.
with the one glass of water, you just mix it and add 1 teaspoon, one spoon of the green apple, this one, vinegar.
Vinegar.
Early morning,
Okay.
take for 7 days. That
Okay.
will go.
Okay.
Okay?
Okay, sir. Okay.
Okay, bye.
Okay. Thank you, sir. It is the last question. Okay. Okay, sir. Thank you very much.
For
Thank you.
getting fees, you just to give some SL, eh? Otherwise, we
Okay.
can't demand any fees.
Okay.
So
Okay, bye.
thank you everybody for
I'm
joining
very
our
much
class
thankful
today.
to you all are attending this case, this class patiently and encourage me once more time. Thank you very much.
Thank you, sir. Thank you. We'll wind up.
Okay, thank you, everybody.
Thank you. You can close the session. Thank you.